All right, well, good morning, everyone, and welcome. I'm glad you all found it. This is definitely a unique venue for us, so we'll see how it goes. But welcome to the 2020 SAUCHEC Annual Awards Ceremony. As your dean, it's my pleasure to host you here today, and I'm very pleased that at least some of us can be here to do this in person. As you know, COVID-19 has forced us to do many things differently this year, and the ceremony is no exception. We are streaming today's ceremony live, and it's also recorded for anybody who cannot participate with us. Today, we're pleased to have with us Major General John J. DeGose, Commander of the 59th Medical Wing, and Brigadier General Wendy L. Harder, Commanding General Brooke Army Medical Center, and together both General DeGose and General Harder make up our SAUCHEC Command Council, and they will be presenting today's awards. Before we get started, I would like to say just a few words about awards and why we take time to celebrate these accomplishments. First, I'd like to highlight that this event is really bigger than about awards and award winners. It's really an opportunity to stop what we're doing and take a few moments and celebrate what we do here at SAUCHEC. Oftentimes we're focused appropriately on our daily activities, lately consumed by COVID-19 adjustments, perhaps on the readiness mission, focusing on meeting currency targets or even business targets and making sure that we're seeing the right amount of patients and having appropriate access for our patients. And these are all important aspects of what we do in military medicine. And for sure, our patients, both abroad on the battlefield and in our stateside facilities, are why we exist and why we are in uniform. But today, we're here to celebrate the privilege of serving at SAUCHEC, where we enjoy the opportunity to develop skills, to instill values in our trainees. We as faculty get to take very moldable medical school students and allied health graduates and train them into specialists that are incredibly competent and professionals, ready to go wherever our nation needs them to go, and ready to lead medical teams. And we're all a part of that. You all take on this responsibility very well. Those of you who are trainees enjoy the opportunity to become experts in your field while serving your country, knowing that you are learning from those who genuinely care about your success. So I hope you all take at least a little time each day to reflect on how fortunate we are to be in the roles that we are in, and how these roles, how you take on these roles with your core being. It is truly a sacred trust given to us by our nation, both to continually learn as best as we can to apply the knowledge and skills to our patients, and subsequently to teach and inspire those who follow us. Now, about the awards. In the audience are the finalists for each award category. I want to say well done for being here. It's an honor to be nominated, and your efforts and contributions have been noticed and appreciated. Take pride in what you have accomplished, but also take pride in knowing that you inspire the rest of us to serve at a higher level. And this is coming from somebody who, despite being in San Antonio military medicine community for 17 years, has never won a single one of the awards that some of you are going to win today. And so it's okay not to win. It's great just to be here. It's great to be a part of our organization and participate in the mission that we are all privileged to be a part of. And so, even so, I was inspired as I read through your nomination packages. And the rest of us here today, and those watching you on a streaming platform, are all also inspired by you. All of us have much to be proud of, and I'm very thankful to serve as your dean. So I'm going to ask our commanders at this time to go ahead and get ready as we prepare to have the award winners come up. The way that we're going to do this is the award winners, when announced, will come up on stage left. You will receive your award from your respective general officer. And no handshakes, no salutes. Stand right in the middle. pose for a photograph, and then exit stage right. So hopefully that makes sense to everybody. And also, you're configured right now with the first category of awards being up front. So once that category is over, we're going to ask that group to move towards the back, and then subsequent categories to go ahead and move forward. So it may be a little bit complicated, but I know you're all very smart and can figure out how to make this work. So it's one person per stone. Come forward as your category gets closer, and such that when your category is being announced, you're in one of these front rows. Okay? All right. Hopefully that makes sense, and we'll figure it out as we go along. So let's get started. The first set of awards will be the research awards. There's a lot of them. Appropriately, SAUCHEC is an academic institution, so it is fitting that we take time to recognize those who have excelled in the realm of research, not only in presenting abstracts or posters, but who have also taken the final difficult step in preparing manuscripts for publication. So doing so requires extra time and energy, often beyond typical work hours, extending into the late hours at home. Therefore, all of these awards represent many hours of work on the part of each finalist. And so I'm going to ask Dr. Michael Morris, our Assistant Dean for Research, to announce these awards.
Okay, well, thank you very much, Mark. Make sure I speak into this properly. The first award that we give out, we usually give out at the awards dinner. And these people have already been recognized once, but we like to do it in a more formal venue so we can recognize them again. On a quarterly basis, we give out the Scholarship in Action Award, and this is given to one of the staff physicians who has an outstanding published manuscript based on journal impact, military applicability, and other factors. And usually we recognize them quarterly with an achievement award at the Scholarship in Action Board outside the emergency room. So we want to recognize those recipients right now. Our first quarter recipient for FY19 is Major Andrew Hirsch, Air Force Pulmonary Critical Care, for his paper, Lower Glucose Target is Associated with Improved 30-Day Mortality in Cardiac and Cardiothoracic Patients, that was published in Chest. Andrew? And you guys can start walking up when I mention your name. Okay. Our second quarter recipient for FY19, Lieutenant Colonel Matthew Borgman, Army, Pediatric Critical Care, for his paper, Hemostatic Responses to Exercise, Dehydration, and Simulated Bleeding in Heat-Stressed Humans. It was published in the American Journal of Physiology. Our third quarter recipient for FY19 is not here. Lieutenant Colonel Kevin Akers from Infectious Disease, Army, who's already PCS'd, for a 12-year analysis of non-battle injury among U.S. service members deployed to Iraq and Afghanistan. It was published in JAMA Surgery. And our fourth quarter recipient for FY19, Dr. Matthew Reed, we gave him a pass because it's his wife's birthday, from the DIVBEC, Adversity and Resilience are associated with outcomes after mild traumatic brain injury in military service members. It was published in the Journal of Neurotrauma. So thank you and congratulations to all those women. Our second award is the House Staff Hall of Fame, and this is another plaque that we have up by the emergency room near Scholarship in Action. This is presented to graduating residents and fellows who have demonstrated excellence in scholarly activity throughout their training here at SAUCHEC. The awardees with the most publications and presentations are being recognized today for exceeding the SAUCHEC requirements, which is one paper. The residents being honored here today, for instance, have nearly have 20 publications apiece throughout their 4-year residency. So this year's recipients for the Resident Award, Captain Grant Justin, Air Force, Ophthalmology. And the second award winner is Captain Donovan Reed, Air Force Ophthalmology. The 2020 Fellow Award goes to Major and Catherine Lago, Army Infectious Disease. Our next award is the Commander's Research Award, and it's my distinct pleasure to showcase the talents of our graduates and announce the winners. This competition was started in Doty Bratton by the Department of Clinical Investigation in the early 1980s, and it's been around so long that I even won one when I was graduating. So, research manuscripts from graduating fellows and residents are reviewed by a faculty panel of 12 judges to determine our winners. The faculty reviewers from SAUCHEC programs should be particularly commended for the difficult task of reviewing these papers. As in previous years, nearly 40 manuscripts in six different categories were submitted. The titles of the projects will give you an idea of the academic and research excellence that exists within SAUCHEC. Keep in mind that all these projects were done in the midst of their training programs, and in many cases, these manuscripts have already been published in peer-reviewed journals. So our first category is Allied Health. We have a one awardee, that is Major Amy Moore, Specialist Corps Army Emergency Medicine PA, for a comparison of laryngeal handshake method versus the traditional index finger palpation method in identifying the cricothyroid membrane when performed by combat medic trainees. In the category of quality improvement and patient safety, we have one award winner, and that's Major Lisa Ingiotti, Air Force Surgical Critical Care, for her paper, Electronic Trauma Resuscitation Documentation and Decision Support using T6 Health Systems Mobile Application, a Combat Trauma Center pilot program. In the category of resident primary care, our third place winner is Captain Hannah Gail, Air Force Pediatrics, Pediatric Trauma Patient Intensive Care Resource Utilization in U.S. military operations in Iraq and Afghanistan. Second place goes to Lieutenant Commander Stephen M. Hughes, Medical Corps Navy, Internal Medicine, for long-term outcomes of thoracic trauma in U.S. service members involved in combat operations. And the first place winner is Captain Joshua Boster, Medical Corps, U.S. Army, Internal Medicine. Adoption of a coronary artery disease reporting and data system reduced downstream testing and cardiology referral rates in patients with non-obstructive CAD. In the category of resident surgical, third place is awarded to Captain Marshall Hill, Army, Ophthalmology, review of postoperative care following refractive surgery in the U.S. military. Second place is awarded to Major Caitlin Peace, Air Force, General Surgery, initial safety analysis of a randomized phase 2 trial of Nepolipimut S and GSMS, GM-SCF, and trastuzumab compared to trastuzumab alone. I'm not doing the whole thing. And our first place winner is Major Tommy Brown, Army, General Surgery. Final analysis of a phase 1/2 trial of folate-binding protein-derived E39 peptide vaccine to prevent recurrence in ovarian and endometrial cancer patients. In the category of animal and basic science, third place is awarded to Captain Donovan Reed, Air Force, ophthalmology, repair of a full-thickness eyelid defect with a bilamellar full-thickness autograft in a porcine model. Second place is Captain Amy Reed, Air Force, urology, duration of ureteral stenting following uteroscopic perforation in a porcine model. And the first place winner, Major Christopher Corkins, Army, General Surgery, a longitudinal comparative study of Manuka and silver-based dressings in a porcine partial thickness burn injury model. And our final category of fellow clinical, third place is awarded to Major Joshua Anchin, Air Force neonatology, a different kind of battlefield identifying acute stress, post-traumatic stress, and depression symptoms in military NICU patients. Second place is awarded to Major and Catherine Lago, Army, infectious disease, impact of doxycycline as malaria prophylaxis on risk of influenza-like illness among international travelers. And our first place winner is Major Brittany Nieves, Air Force, allergy immunology, IFA immunotherapy with intervals extended to 12 weeks. Congratulations to all the winners in all of these categories. Okay. I'm trying not to compete with the train. It is now my pleasure to introduce Colonel Thornton Moo, the Associate Dean for Army Graduate Medical Education, who will present the Outstanding Faculty Awards.
Good morning, Generals DeGoes and Harder, leaders and nominees. It is my privilege to present this year's Outstanding Faculty Awards to recognize the tireless efforts and leadership shown by SAUCHEC faculty members. For the next series of awards, I will be announcing the finalists who will stand in place to be recognized. Then I will announce the winner who will be invited to come on stage to receive the award. I will now introduce the Professionalism Award, which is presented to the faculty member who exemplifies the professional delivery of healthcare manifested by accountability, excellence, integrity, service, and respect for others. Award finalists, as I call your name, please stand and remain standing. Captain Kristen E. Bader, Internal Medicine. Colonel Retired Anthony J. Johnson, Ophthalmology. Major Sarah J. Ostrom, Emergency Medicine Physician Assistant. And the recipient of this year's Professionalism Award goes to Colonel Retired Anthony J. Johnson, Ophthalmology. Dr. Johnson, please come on stage.
Congratulations.
The Quality Improvement Patient Safety, or QIPS, Award recognizes a faculty member who has dedicated themselves to identifying systemic issues in quality care and patient safety, learning lessons from these issues and seeking iterative changes to form the foundation of SAUCHEC's culture of safety. Award finalists, as I call your name, please stand and remain standing. Lieutenant Colonel Aaron Betts, Radiology. Lieutenant Colonel Sarah Bowe, Otolaryngology, and she is deployed. Dr. Weitzel standing in her stead. And Lieutenant Colonel Angela Fagiana, Neonatology. She has actually already left San Antonio, on to her next assignment. The recipient of this year's QIPS Award goes to Lieutenant Colonel Sarah Bowe, Otolaryngology. As she is deployed, Colonel Eric Weitzel, previous Otolaryngology Program Director, will accept the award on her behalf.
Yes, there is such a superstar. Yeah, thank you.
At least mail that to
I
her.
will.
So-
She's deployed at the moment, so we'll get it to her. Thank you. Thank you.
The Lieutenant General Paul K. Carlton, Jr. Award was named in honor of General Carlton, former 59th Medical Wing Commander and Surgeon General of the Air Force. As a general surgeon and expert in medical crisis response, his work led to the development and adoption of the Critical Care Air Transport Team, CCAT, methodology of care that is the standard of what we do today. The Carlton Award recognizes an outstanding faculty member within graduate medical education. Award finalists, as I call your name, please stand and remain standing. Major Britt Long, Emergency Medicine. Major Luke Surrey, Internal Medicine. He happens to be deployed right now. Lieutenant Colonel Robert Walter, Pulmonary Critical Care. And the recipient of this year's General Carlton Award goes to Major Britt Long, Emergency Medicine. I would now like to introduce Dr. T.J. Bonjour, Associate Dean, Graduate Allied Health Education, who will present several Allied Health Awards.
Good morning and greetings. It is my honor to present this year's Graduate Allied Health Awards. Graduate Allied Health professionals are highly trained and skilled advanced practice specialist practitioners. SAUCHEC leads the way, sponsoring the Department of Defense's largest graduate allied health education training platform. We're developing tomorrow's leaders and medical specialists who train alongside our GME residents and are prepared to serve in a variety of worldwide and forward deployed military settings, complementing core physician staff. This is an inaugural year for 3 newly named Allied Health Awards, which were named after individuals who have truly inspired our community. We are also privileged to have these three individuals with us here today in the audience, and we will invite them on stage to present their inaugural award to this year's winners. The Graduate Allied Health Faculty of the Year Award is named for Colonel Gerald Wayne Talcott. Colonel Talcott, please come to center stage. Colonel Talcott's service in the United States Air Force transformed education, training, and the delivery of mental health services. His impact on the clinical psychology residency and the clinical health psychology postdoctoral fellowship programs at Wilford Hall Medical Center and now Ambulatory Surgical Center provided a professional foundation for countless trainees, shaping the character of Air Force psychology education. His innovation and foresight led to the development of the Air Force's community-based suicide prevention program and integration of mental health providers in Air Force primary care clinics, which is now also the standard across the Department of Defense and civilian healthcare institutions. The Talcott Award represents how crucial and important it is to have these exemplary faculty educating and training the next generation of allied health specialists. Award finalists, as I call your name, please stand and remain standing. Captain Shanice Cyrus, General Surgery Physician Assistant. Major Andrew Dunkel, Clinical Health Psychology, Air Force. And Lieutenant Colonel Enrique Smith Forbes, Occupational Therapy. The recipient of this year's Colonel Talcott Award goes to Lieutenant Colonel Enrique Smith Forbes, Occupational Therapy. The Graduate Allied Health Trainee of the Year Award is named for Colonel Woodson Scott Jones. Dr. Jones, please invite us to center stage. Colonel Jones is a retired Air Force pediatrician and former dean of SAUCHEC. Colonel Jones' vision of interdisciplinary education and training, integrating graduate medical education and graduate allied health education, led to the inclusion of the Graduate Allied Health Education into the training consortium. His leadership, dedication, and innovative efforts with a synergistic approach paved the way, translating into increased collaboration, education training, and treatment of San Antonio Military Health System beneficiaries, while also generating a new educational model for medical education institutions. The Jones Award honors the Graduate Allied Health Trainee of the Year who best exemplifies excellence, innovation, and service extending well beyond their respective training program requirements. Award finalists, as I call your name, please stand and remain standing. Major John Bluestar, Clinical Health Psychology, Air Force. Captain Jordan Ellis, Clinical Psychology Internship, Air Force. And Dr. Anna Marie Marinin, Clinical Health Psychology, Army. The recipient of this year's Colonel Jones Award goes to Major John Bluestar, Clinical Health Psychology, Air Force. The Graduate Allied Health Program Director of the Year Award is named for Colonel Gail D. Dyle. Colonel Dyle, please join us on stage. Colonel Dyle is a retired Army physical therapist who helped define postgraduate training for allied health professionals. In 1995, he founded the current Physical Therapy Fellowship at Brooke Army Medical Center. Established initially as a clinical residency, with his vision and work, it evolved into a dual clinical fellowship and terminal doctorate degree program, affiliated with Baylor University. His work was the impetus for the creation of numerous other Baylor University-affiliated doctoral programs across several medical disciplines. Graduates of these programs are nationally recognized clinicians, educators, and researchers, largely because of Dr. Dyle's example and commitment to elevating clinical practice, developing leaders within the military healthcare system. The Dyle Award represents a selfless educator, creating defined impact and influencing medicine while charting a future course for their educational program, especially in uniformed service. Award finalists, as I call your name, please remain standing in place. Major Raymond Beckman, Clinical Psychology Internship, Army. Major Adam Kiefer, Dietetic Internship. Major Brian Pickens, Orthopedic Manual, Physical Therapy. Major Stephen A. Smith, General Surgery, Physician Assistant. The recipient of this year's Colonel Dyle Award is Major Brian Pickens, Orthopedic Manual, Physical Therapy. I would now like to introduce Colonel Brian Fox, the Associate Dean for Air Force, GME, who will present the next GME Program Awards.
Good morning. The first award is named in honor of Major John Gillespie, a graduate of our BAMC Transitional Year Program, who made the ultimate sacrifice while serving in Saudi Arabia during Operation Desert Storm in 1991. The Major Gillespie Award is presented to the SAUCHEC intern who best exemplifies excellence in medical knowledge, clinical judgment, and professionalism. Awards finalists, as I call your name, please stand and remain standing. Captain William Hoffman, Internal Medicine. Captain John Marinelli, Otolaryngology. Captain Maggie Moran, Emergency Medicine. The recipient of this year's Major John H. Gillespie Award is Captain John Marinelli, Otolaryngology. And again, we're going to have Colonel Weitzel stand in. Captain Martinelli was not able to attend today's ceremony.
We got some exceptional folks. Thanks, ma'am. Thank you.
Next is the award to honor Major David S. Berry, a dynamic young SAUCHEC pediatric faculty member who was tragically killed while on assignment in Korea in June of 2000. This award is presented to the graduating SAUCHEC resident who best exemplifies the spirit and character of Major Dave Berry, which included superb professional competence, outstanding collegial relations as a teacher, mentor and consultant, and an exemplary ability to balance personal and professional life. Awards finalists, as I call your name, please stand and remain standing. Captain Hasey Asusta, Obstetrics and Gynecology. Captain Joshua Boster, Internal Medicine. Captain Timothy Durso, Dermatology. Captain Rebecca Grote-Weil, Radiology. Captain Kai Hatta, not able to be in attendance today, from General Surgery. Captain Amy Reed from Urology. Captain Donovan Reed from Ophthalmology. Captain Shannon Thompson from Emergency Medicine. Congratulations. The recipient of this year's Major David S. Berry Award is Captain Donovan Reed, Ophthalmology. Our next award is the Outstanding Award for Fellows, named in honor of Colonel David M. Nall. Colonel Nall is a retired Air Force neonatologist whose team at Wilford Hall in the 1980s and 90s developed many of the therapies which are routinely used to care for critically ill newborns today. His efforts led to the creation at Wilford Hall, the Department of Defense's first neonatal extracorporeal membrane oxygenation team, or ECMO for short, and the world's first transcontinental ECMO transport team. These advancements in San Antonio paved the way for this critical life-saving intervention to be broadened to transport severely injured active duty soldiers out of theater, and within the COVID pandemic we're facing now. Awards finalists, as I call your name, please stand and remain standing. Captain Jared Cohen, Emergency Medicine Ultrasound. Major John Kiley, Infectious Disease. Major Lauren Lee, Hematology Oncology. The recipient of this year's Colonel Nall Award is Major John Kiley, Infectious Disease. Next are the awards to honor SAUCHEC Outstanding Program Staff. There's no question in my mind, without the passion, commitment of our program coordinators and program directors, there would be no SAUCHEC. The recipients today represent the remarkable talent and expertise we have come to expect at SAUCHEC. First is our Outstanding Program Coordinator Award. Ms. Ilda Benavides, a former program coordinator, envisioned this award years ago to recognize the exceptional work and contributions of the best of our SAUCHEC program coordinators. These individuals work behind the scenes, taking care of mountains of paperwork and run the administrative issues which enable the training programs to run smoothly. Awards finalists, as I call your name, please stand and remain standing. Ms. Concepcion Cooper, Emergency Medicine. Ms. Tracy Gruber, Anesthesiology and Pain Medicine. Ms. Carmen Vargas, Internal Medicine. And the recipient of this year's Ms. Ilda Benavides Award is Ms. Tracy Gruber from Anesthesiology, Pain Medicine. Ms. Gruber was not able to attend today's ceremony, and in place, Major Joshua Hauser, Anesthesia's Associate Program Director, will accept the award on her behalf. Our next award is the Colonel John D. Roselia Award, named in honor of our former pediatric program director and SAUCHEC dean, a dedicated and selfless educator who was instrumental in helping build the consortium into what it is today. This award recognizes the outstanding SAUCHEC GME program director. Awards finalists, as I call your name, please stand and remain standing. Cytopathology, Colonel Samantha Butler Garcia. Internal Medicine, Colonel Joshua Hawley Malloy. Ophthalmology, Major Promotable Gary Legault. Pulmonary Critical Care, Lieutenant Colonel Edward McCann. Transitional Year, Lieutenant Colonel Dan Steigelman. Obstetrics and Gynecology, Lieutenant Colonel Larissa Weir. The recipient of this year's Colonel John D. Roselia Award is Lieutenant Colonel Larissa Weir, Obstetrics and Gynecology. Congratulations. I'd like to now introduce Colonel Andre Kapp, last year's Gold-Headed Cane Award winner, who will present this year's Gold-Headed Cane Award. Dr. Kapp.
Good morning. Well, the Golden Headed Cane is actually not a SAUCHEC award, as many of you might know, but it's awarded to those who have previously been honored, but is awarded by those who have previously been honored with the cane. The Golden Headed Cane symbolizes the best academic medicine has to offer in the three arenas that are its focus: patient care, teaching, and clinical research. The original cane was carried from 1689 until 1825 by 6 distinguished British physicians who cared for royalty. The gold-headed canes have since been given at many medical schools to singularly outstanding students. It was with this in mind that former Director of Professional Services, Dr. John Sharp, instituted the tradition at Wilford Hall in 1992, adapting it to annually honor a faculty member voted by previous awardees to represent all-around excellence, including consideration for contributions in military operational medicine. In 2009, the award expanded to include all active duty SAUCHEC faculty. You can read their full bios in the program. Nominees, as I call your name, please come on stage to receive your medallion from your service's commander. For social distancing guidance on the small stage side, after the medallion is handed to you, please hang it over your own neck and pose for your photo. When the reading of your biography is complete, please exit the stage and line up in front of the stage facing the audience. So first I'd like to call up Lieutenant Colonel Christopher Allen, U.S. Air Force, Urology. Lieutenant Colonel Allen earned his medical degree from the Chicago College of Osteopathic Medicine in 2005. He completed residency in urology at SAUCHEC in 2011, followed by fellowship in endourology and robotic surgery at the University of Michigan in 2013. After an assignment at Eglin Air Force Base, he returned to San Antonio in 2016, where he is currently the urology program director and Air Force consultant to the Surgeon General. All right. Congratulations. Next, I'd like to call Lieutenant Colonel Aaron M. Betts, U.S. Army, Radiology. So Lieutenant Colonel Betts started his military career as an Army optometrist at Walter Reed and earned his MD from Uniformed Services University in 2007. He completed residency in diagnostic radiology here at SAUCHEC, followed by fellowships in both neuroradiology at University of Cincinnati and pediatric neuroradiology at Cincinnati Children's Hospital Medical Center. Lieutenant Colonel Betts has served as core faculty and staff for diagnostic radiology since 2015. He currently serves as the Chief and Medical Director for the MRI section. Congratulations. Next, I'd like to call Lieutenant Colonel Promotable Matthew A. Borgman, U.S. Army, Pediatric Critical Care. So Lieutenant Colonel Promotable Borgman graduated from the Uniformed Services University Medical School in 2004. He then completed pediatric residency at BAMC in 2007, followed by a fellowship in critical care at Boston Children's Hospital. Lieutenant Colonel Borgman is currently the Chief of Pediatric Critical Care and Medical Director for the BAMC Simulation Center, as well as the Army Consultant for Medical Specialists in Simulation throughout the Army. Congratulations. The next nominee is Colonel Thornton Moo, U.S. Army Neonatology. So Colonel Moo initially served 3 years as a Medical Service Corps lieutenant with the 25th Infantry Division, and then earned his MD from Texas Tech School of Medicine in 2003. He then completed pediatric residency at SAUCHEC, followed by neonatology fellowship at Tripler Army Medical Center. Colonel Moo is currently the Associate Dean, Army Graduate Medical Education, where he provides direct oversight for Army trainees in 37 programs. Colonel Moo recently served as the Neonatology Fellowship Program Director from 2015 to 2019, and Pediatric Residency Assistant Program Director for Research from 2012 to 2015. Congratulations. Okay, and our last nominee is Colonel Jason F. Coolidge, U.S. Air Force, Infectious Disease. He cannot be present today, so standing in for him is previous Golden-Headed Cane Award winner, Colonel Heather Yoon. So, Colonel Coolidge received his MD from Rutgers Medical School. He completed his internal medicine residency training at Wilford Hall Medical Center, followed by a term as Chief of Residence. He then completed infectious disease fellowship training at SAUCHEC. Colonel Coolidge is currently the BAMC Chief of the Infectious Disease Service and the Infectious Disease Consultant to the U.S. Air Force Surgeon General. He has chartered and served as the chair of the DHA Tri-Service Infectious Disease Working Group and the Tri-Service HIV Working Group. And now, the moment you've all been waiting for. The recipient of this year's Golden-Headed Cane Award is Dr. Coolidge. So normally we would have Dr. Coolidge come and receive the come back on stage to receive the cane. We'll have Dr. Yoon stand in for him and probably leave the cane on stage. So congratulations to all. All right, and now Dr. True will conclude today's ceremony. Thank you.
So congratulations again to each of our nominees and winners in these highly competitive categories. You all are a credit to our organization, and we hope you understand how highly you are valued. Thanks also to the commanders, supervisors, and mentors who took the time to nominate excellent professionals for these awards. And a special thank you to John Weber, some of our staff, Michelle Valdez, Jana Burke, Linda Wiggins, Jerry Garrison, Dave Stamper, Jennifer Booker, for organizing this event. This concludes our ceremony today. Thank you for joining us, and have a great day.